All right, today we are pulling back the curtain on something that so many people deal with but is often just completely misunderstood. We're talking about premenstrual dysphoric disorder, or PMDD. We're going to break down what it really is, how you can figure out if you have it, and most importantly, what you can actually do about it.
So let me just start by asking you this, right to the point. Does it ever feel like your emotions get completely hijacked by your menstrual cycle? You know, one week you're feeling totally fine, you're in the driver's seat, and the next, bam, you're suddenly on this emotional roller coaster that you definitely did not buy a ticket for.
If you're nodding along right now, I want you to know you are so not alone. When those mood shifts before your period feel less like a minor annoyance and more like a full-blown monthly storm, that's a huge sign that this could be way more than just PMS. And here's the most important thing. You don't just have to white-knuckle it and get through it every month. There is real, effective help out there.
Okay, so let's start right there with recognizing the signs. How can you tell the difference between just having a really tough week and dealing with an actual clinical condition? Let's figure out who this explainer is really for.
So this is for you if you're experiencing really severe mood swings, anger, or sadness right before your period. It's for you if you're noticing these emotional shifts are starting to cause real problems at work or with the people you love. Or maybe it's just this vague feeling of being mentally off, but it happens like clockwork at the same time in your cycle. Heck, maybe you already suspect it's PMDD and you just need some support, a non-judgmental space to finally understand what's going on.
So now that we've kind of identified what this feels like, let's put a name to it. Because you know what? Defining what's happening, just giving it a name, is probably the most powerful first step you can take toward getting a handle on it.
So here's the official definition. PMDD is a condition that's all about intense mood changes. And when I say intense, I mean it. We're talking about significant anger, really bad anxiety, or just bouts of tearfulness that show up like an unwanted guest in the week or two leading up to your period, and then poof, they usually vanish right after your period starts.
And this right here, this slide is so key because it shows the huge difference between PMS and PMDD. Now, here's the thing that blows a lot of people's minds. It's not about having weird or abnormal hormones. It's about having an abnormal response to your completely normal hormone fluctuations. Look at the language here. For severe PMS, the word is disruptive. It gets in the way of your life. But for PMDD, the word is disabling. The emotional symptoms are so intense, they can literally stop you from functioning. That difference, it's everything.
Okay, so if you're thinking, wow, this sounds a lot like me, the next question is obvious. How do you get a clear diagnosis? Well, the answer might actually surprise you.
So, the big question, do you need to get your hormones tested? And the answer, surprisingly, is usually no. See, PMDD isn't diagnosed by finding some weird hormone level in a blood test. Doctors actually use those tests to rule out other things, like a thyroid problem that could be causing similar symptoms. The real key to a diagnosis is found somewhere else entirely.
The path to getting clarity is really a three-step process. And honestly, step one is the most important part of this whole thing, cycle tracking. And this is not just a casual suggestion. It is the absolute core of the diagnosis. You have to track and map your symptoms for at least 2 full menstrual cycles to see that clear pattern emerge. It's only with that data that a doctor can then do a professional evaluation and rule out other things to confirm if it's PMDD.
So, once you have that diagnosis, that clarity, what does help actually look like? Well, it's not about finding one single magic bullet. It's more about building your own personalized toolkit for wellness, using what's called an integrated approach.
Okay, pillar number 1 is therapy. Things like cognitive behavioral therapy, or CBT, are amazing for this. They help you catch and challenge those negative thought spirals that can just take over during that premenstrual phase. The whole point isn't to change your hormones, but to change how you respond to them. It gives you real, practical tools to build up your emotional resilience. Pillar number 2 is medical support. And for many, this can be an absolute game changer. A psychiatric evaluation might open up options like SSRIs, and sometimes those are only prescribed for the second half of your cycle, or maybe some hormonal treatments. This is where having a great team is so important. Your mental health professional and your gynecologist talking to each other and working together.
And finally, pillar number 3, lifestyle. Now, this is not about being perfect, it's just about being supportive of your body. Little things, like focusing on complex carbs instead of sugar, or cutting back on caffeine, can make a real difference in stabilizing your mood. Regular exercise can take the edge off anxiety. It's all about becoming aware of your own cycle and making small choices that work with your body, not against it. And that brings us to what I think is the most important piece of this whole puzzle, and that is validation. It's knowing, really knowing, that you are not making this up, and you are not alone in this fight.
I really want you to listen to this quote. What if I've been told it's just in my head? We take your symptoms seriously. Hormonal mood disorders are real, and we provide science-based care without dismissal. I mean, just let that sink in. If anyone has ever made you feel like you were being dramatic or that this was all in your head, I need you to hear this loud and clear. It is real. Your symptoms are real, and you absolutely deserve to be taken seriously.
You know, this feeling of being dismissed is way too common. In really high-pressure places like Dubai, for instance, women are often juggling insane work stress, high expectations, and this sort of cultural silence around mental and hormonal health. That can feel so isolating, but I promise you, it's a shared struggle.
So, I'm going to leave you with this final thought to chew on. Just take a second and really ask yourself, what could change? What could your job feel like? Your relationships, your own inner peace? What could all of that look like if you started to truly, fiercely advocate for your own emotional health? Thanks so much for being here with me today.